My abstract is about hepatitis C diagnostic barrier to effective linkage to care within Georgia Hep C elimination program. HCV remains significant public health challenges in Georgia, with anti-HCV prevalence of 7.7% and an estimated 150,000 persons are HCV infected. As regards prevalence of PCR positive cases is 5. Excuse me.
Let him take it away a bit. Yeah.
It's 5.4%. Prevalence, the most affected risk groups for this infection are PVDs, and so prevalence of HCV in PVDs varies between from 50 to 92%. In 2050, Georgia started Hep C national elimination program. And it was very interesting to estimate involvement of PVDs from harm reduction program into Hep C elimination program. So methods, the data was generated from harm reduction program and recordings of outreach workers and visiting counselors that were supporting PVD in linkage to care. So the result shows that in 2070, about 25,000 HCV testing were performed, and among them, HCV positive cases among PVDs detected, and it was 30%. We estimate numbers of involvement in Tbilisi, which is capital of Georgia, and in other regions. But there is no, you see that there is no difference in Tbilisi. It's the involvement of PVDs in program is 53%, and in other regions is 52%. This is what's about barriers. Main barriers of involvement in Hep C elimination program. One of the, at the first place, is a financial barrier, which includes that even though treatment is free of charge in Georgia, patients have to pay part of diagnostics out of their pockets. So it's the main barrier for PVDs. So to involve in Hep C elimination program. The second place is low motivation of beneficiaries to be treated, and also it's following a geographical barrier, which includes restricted geographical access to the medical facilities. Stigma and self-stigma is also the reason of refusal, and at the last myths about side effects of medications. And also it's I should mention that some of beneficiaries don't believe this program, don't trust, and they think that it's like experiment, and so it's one of the reasons that they don't want to involve this program. In conclusions, the study results demonstrate that free medication is not enough for involvement in the treatment program. Free diagnostic is necessary for effective linkage to care, especially for high-risk groups. Capacities or harm reduction programs should more actively be used for linkage to treatment services. And at the last, proper risk counseling and disease awareness activities by informational educational campaigns are inevitably important to increase involvement of PVDs in HCV elimination program. Thank you for your attention.
That was lovely, thank you. So, is it HCV antibody positive or RNA positive, those 7,500? Were they antibody positive or RNA?
It's antibody positive.
Okay.
Yes.
And do you know how, of the antibody positive patients, how many of them in the ones you did test were RNA?
All antibody positives referred, all of them referred to the treatment program.
And how many were RNA positive? The majority?
Yes, half of them are RNA positive.
So that's a big barrier, because you're only going to treat the people who are RNA positive, and the patient has to pay for that.
Yes.
So if you go for hepatitis C testing, the hepatitis C RNA determination you have to pay yourself.
Please repeat the question.
So does the patient have to pay for the RNA?
Yes, patients have to pay some diagnostic.
But not for antibody?
No, not for antibody, for RNA. Yes.
For an RNA test?
Yes.
Okay.
Yes.
All right, and that is expensive.
Yes.
Corinne?
It's more a comment than a question, but then you can comment my comment because it's to trigger the discussion. I think that what you pointed out is very important. It's not even a question of treatment anymore. It's really a question of screening and evaluation. And in every country where there is no free package offered by the government, then there is a failure in tackling the epidemic. It's like in Africa. In Africa, treatment is widely available through generics, but because the screening and evaluation has to be paid by the patients, nobody's treated. Yeah. And in a resource-constrained country, that's really the big problem. And the problem we have with hepatitis C that we don't have with HIV is that there are no international donors like the Global Fund who finance this kind of the tools for diagnosis and follow-up. And that's why tackling the HIV epidemic on a global level is so difficult.
Yeah. A question over there?
Nice presentation. What percent of patients are immigrants? I work in a heart reduction unit in Madrid. I have 25% are immigrants. What percent of them are immigrants? Is free the medication in immigrants in Georgia in this program?
I don't have data how much is immigrant include. My colleague Maya, it's clinicist and he knows.
Could you give her the microphone?
Hello everybody, I'm from Georgia, I'm clinician and I'm involved in this program. So none of the immigrants are treated because the inclusion criteria to be included in our program is the citizen of Georgia. So no citizens of other countries or immigrants are allowed to treat it.
Okay.
These drugs were donated by Gilead, as you know, and it has very strict inclusion criteria, yes. And regarding these PCR positives, I can answer you that the vast majority are PCR positive, so 85%.
Okay, great.
Thank you.
Nicholas?
Simple question. Was the first determination of antibodies for all the patients, or patients were tested before, or was the first assessment of hepatitis C infection in your population?
Can you repeat, please?
Was the first time that patients underwent an antibody determination? The first time that they were tested for Hep C?
We referred all antibody positive cases to refer in the elimination program.
Maybe you want to add something to that?
Could you give her the microphone again, number 2?
Thank you very much. So you are asking a question about this 7.7%, yes? That were antibody
He's
positive.
asking the 25,000
Yeah,
that were
so it
tested,
was a
was
study,
this
yeah.
first time tested?
It was a study conducted in 2015 by the National Center of Disease Control throughout the Georgia, and randomly where general population was randomly sampled and tested. So HCV positive prevalence was 7.7%, and out of them PCR positive were 5.4%. So regarding these PWIDs, they are screened routinely by harm reduction centers, all of them, as a consecutive sample. Okay.
Okay. I think we move on, no?
We've got 2 minutes.
You got 2 minutes?
Yeah.
Okay, then I have one more question. Can you, because there are a lot of people still with stigma, low motivation, so it may be difficult for people with injection drug use to go to some of the official centers. Can you also treat in the harm reduction center or in the methadone substitution center, which may be an easier approach to therapy? You know, if you go to get your methadone, for example, can you then also receive your hepatitis C treatment in that center?
No, they ought to go to medical facilities to treat.
But do you think you could change the plan and let the medicine come to you? It's possible?
Yes.
Yeah, because I think in the end that might be a way to get some of the people involved is to take the medicine to them rather having go to a different center, which may be a challenge altogether. All right.
Thank you very much.
Thank you very much.